5 subtle signs your loved one may be nearing the end. Don't miss these quiet warnings. Imagine sitting across from your grandmother, her once vibrant eyes now dim, her favorite cardigan hanging loosely on her frail frame. Over the past year, you've noticed small changes. Her laughter is softer, her steps slower, her plate often left untouched. You tell yourself it's just aging, nothing to worry about. But what if these subtle shifts are more than that? What if they're the body's quiet whispers, signaling that time is running out? Many of us believe death in old age comes like a sudden storm, but the truth is far more nuanced. Months, sometimes even a year before the end, the body sends delicate warning signs so subtle they're often mistaken for the natural wear of time. These clues are easy to overlook, dismissed as just getting older, yet ignoring them could mean missing the chance to create lasting memories, provide meaningful care, or ensure your loved one's final days are wrapped in comfort and dignity. In this guide, we'll uncover 5 critical signs that an elderly loved one may be approaching their final year. These aren't just medical symptoms, they're the body's poignant messages, urging us to pay attention. By recognizing them early, you can transform fleeting moments into cherished memories, make informed decisions, and offer the love and peace your loved one deserves in their final chapter. From weight loss to fading energy, these signs are a call to action. Let's listen closely, act with compassion, and make every moment count. 1. Unexplained weight loss. The body's silent cry for attention. Picture your father, once robust and hearty, now struggling to finish half a sandwich. His belt is cinched tighter, his cheeks seem hollow, and his clothes hang like they belong to someone else. Unintentional weight loss is often the first whisper of decline, yet it's so easy to dismiss. He's just eating less, you might think, or it's normal at his age. But when weight slips away without effort, sometimes 10 pounds or more in a few months, it's a red flag the body is waving urgently. This isn't about vanity or appearance. The body is signaling a profound shift. As we age, muscle mass naturally decreases, but rapid, unexplained weight loss points to something deeper. The body may struggle to absorb nutrients as digestion slows or the gut becomes less efficient. Proteins, once the building blocks of strength, may no longer be processed effectively, leading to muscle wasting. This loss doesn't just weaken the body, it heightens the risk of falls, fractures, and infections as the immune system falters. Consider my neighbor, Mrs. Thompson, who at 82 began skipping meals. Her family thought she was just picky, but her weight dropped steadily. It wasn't until a doctor's visit revealed early kidney disease that they realized her body was struggling to sustain itself. For many, weight loss is tied to chronic conditions, cancer, heart failure, or kidney disease that silently progress long before obvious symptoms emerge. Even emotional struggles, like depression or early dementia, can dull appetite, creating a vicious cycle where the body starves for fuel. Appetite changes are another culprit. Imagine your loved one pushing away their favorite pho or apple pie, foods they once savored. The sense of taste and smell often fades in old age, making meals less appealing. For some, the body itself seems to lose interest in food, as if it knows its time is winding down. The brain, sensing the body's decline, stops sending hunger signals, leading to smaller portions or skipped meals. The result? Less energy, less strength, and a body that feels increasingly fragile. Families often try to fix this with coaxing, just eat a little more, or by offering protein shakes and comfort foods. But when weight keeps dropping despite these efforts, it's time to look beyond diet. Forcing large meals can cause discomfort or frustration, especially if the body can't handle them. Instead, focus on what brings ease. Small, nutrient-rich bites like smoothies, soups, or soft fruits. Keep them hydrated with sips of water or herbal tea. These small acts preserve their quality of life far better than a full plate they can't manage. If you notice your loved one shrinking physically or in spirit, don't ignore it. This is the body's way of saying, time is precious. Consult a doctor to rule out treatable causes, but also prepare emotionally. Use this moment to share meals together, even if they're small, and talk about the memories tied to those flavors. It's not just about feeding the body, it's about nourishing the soul. 2. Overwhelming fatigue, when the spirit feels heavy. Think of your uncle, once the life of every family gathering, now dozing off mid-conversation or struggling to climb the stairs. Deep, unrelenting fatigue is more than feeling tired, it's a bone-deep exhaustion that lingers no matter how much they rest. Simple tasks, getting out of bed, dressing, or even chatting over coffee become monumental challenges. This isn't just a long day catching up with them, it's a sign the body is rationing its dwindling energy. As we age, the body's systems slow. The heart pumps less efficiently, circulation weakens, and muscles receive less oxygen. In the final year, the body shifts into preservation mode, redirecting energy to vital functions like breathing and heartbeat rather than movement or activity. This metabolic slowdown can feel like a heavy weight, leaving your loved one unsteady or weak. They might nap longer, sleep through the day, or experience sudden energy crashes, one moment chatting, the next completely drained. I recall my grandfather, who loved gardening but began sitting on the porch instead, too tired to tend his roses. At first, we urged him to keep active, thinking it would help. But his fatigue wasn't laziness, it was his body signaling a profound change. This exhaustion often carries an emotional toll. Seniors who once prided themselves on independence may feel frustrated, embarrassed, or even ashamed. They might pull away from conversations, skip family gatherings, or abandon hobbies, not because they've lost interest, but because they simply can't muster the energy. This withdrawal can spark a cycle of isolation. They stop engaging, which accelerates their decline, leaving families heartbroken as their loved one slips away. It's tempting to push them. Just try a little harder, but this can add stress. Instead, embrace their limits. Create moments of joy in small ways. Share a favorite song, watch a sunset together, or simply sit in comfortable silence. These acts of presence matter more than forcing activity. If your loved one is perpetually exhausted, take it as a cue to slow down with them. Ask yourself, how can I make their days feel safe and loved? Maybe it's reading aloud from a book they cherish or holding their hand during a quiet moment. These gestures say, "You're enough, just as you are." By recognizing fatigue as a sign of transition, you can focus on what truly matters: love, connection, and peace. 3. Confusion and withdrawal. A mind slipping into silence. It's gut-wrenching to see someone sharp and witty, your mother perhaps, who always remembered every birthday start, forgetting names or losing track of time. These aren't just senior moments. Cognitive changes, like struggling to follow conversations or feeling disoriented in familiar places, can signal the brain is struggling. In the final year, the brain, like any organ, suffers as circulation weakens, starving it of oxygen and nutrients. This leads to confusion, difficulty making decisions, or even trouble recognizing loved ones. Sometimes, these moments are fleeting, a spark of clarity followed by a fog of confusion, as if their mind flickers like a candle. My aunt, once a lively storyteller, began repeating herself or staring blankly during family dinners. We thought it was just age, but it was her brain signaling a deeper decline. Emotional withdrawal often follows. Your loved one might speak less, avoid social events, or sit in silence for hours. It's not that they don't care, it's that their brain can't process emotions or engagement as it once did. Mood shifts are common too. Some become irritable or anxious, frustrated by their fading clarity. Others grow eerily calm, detached from passions that once defined them. These changes can feel like losing them before they're gone, leaving families grappling with grief. But they're still there, feeling your love even if they can't express it. Don't try to pull them back into long conversations or crowded rooms. Instead, meet them where they are, speak gently, share simple memories, or play familiar music. A soft touch or a warm smile can bridge the gap words can't. Create a safe, comforting space, familiar photos, soft lighting, or a favorite blanket. These small acts anchor them when their mind feels adrift. If confusion or withdrawal is growing, see it as a call to cherish quiet moments. Tell them you love them, even if they don't respond. They feel it, and that's what matters most. 4. Frequent infections and slow healing, a body losing its defenses. Has your loved one started catching every cold or flu, with recovery stretching on endlessly? A weakened immune system is a stark warning. Once minor illnesses, pneumonia, urinary tract infections, or skin infections become frequent and stubborn. Small cuts or bruises linger, refusing to heal or reopen unexpectedly. These aren't random setbacks, they signal the body's defenses are crumbling. As circulation slows and organs falter, the body struggles to fight infections or repair tissues. Antibiotics that once worked quickly may now seem ineffective, requiring stronger doses or longer treatments. For my cousin's grandfather, a simple scratch turned into a persistent sore, a sign his body couldn't heal as it once did. Pressure sores, especially in those less mobile, become a serious risk, potentially leading to dangerous infections if not managed carefully. What's alarming is how infections manifest in seniors. Instead of a high fever, they might show subtle signs, sudden tiredness, confusion, or loss of appetite. A decline in mental alertness often signals an infection before other symptoms appear. Families may push for aggressive treatments, hoping one more hospital stay will fix things. But at this stage, the focus often shifts from curing to comforting. Keep their skin clean and moisturized, ensure they're hydrated, and minimize stress. These acts do more for their well-being than treatments that prolong suffering. If infections or slow healing are becoming common, don't dismiss them. Consult a doctor to manage symptoms, but also prepare for a shift in care. Create a soothing environment, soft bedding, gentle care, and quiet reassurance. These small efforts can make their final days more peaceful, letting them feel cared for without the burden of endless medical battles. 5. Changes in breathing and circulation. The body's final slowdown. Few signs are as poignant as changes in breathing or circulation. You might notice your loved one's breaths grow shallow, irregular, or pause altogether, sometimes in a pattern called Cheyne-Stokes respiration, deep, rapid breaths followed by long pauses. Their hands, feet, or even nose may feel cold, their skin pale or bluish, as the body prioritizes blood flow to vital organs over extremities. Even small efforts sitting up, talking, or shifting in a chair can leave them winded. These changes reflect a heart and lungs growing weary. Fluid buildup in the lungs may cause coughing, gurgling, or a tight chest, making lying flat uncomfortable. They might prefer sleeping propped up on pillows or in a recliner. My friend's mother, in her final months, struggled to catch her breath after a short walk to the kitchen. At first, we thought it was a cold, but it was her body signaling its limits. These shifts can be frightening, tempting you to urge deeper breaths or rush to the hospital, but often this is the body's natural way of slowing down. Focus on comfort, keep the room cool, use a humidifier or offer small sips of water. Oxygen therapy or medications may ease symptoms, but the goal is peace, not a cure. Be present, hold their hand, speak softly, or play their favorite lullaby. These acts create a sanctuary of love in their final moments. A call to cherish every moment. These 5 signs: unexplained weight loss, overwhelming fatigue, cognitive confusion, frequent infections, and changes in breathing or circulation air, the body's quiet cries, signaling that time is slipping away. They may not all appear at once, and their subtlety can make them easy to miss, but together, they tell a story of a body preparing to rest. It's natural to want to fight these changes, to push for more food, more activity, or more treatments. But sometimes, the greatest gift is acceptance. Listen to what their body is telling you. By recognizing these signs early, you can shift your focus to what truly matters, creating moments of love, sharing stories, and ensuring their final days are filled with dignity and peace. Think of the small things: a shared laugh over a childhood memory, a gentle hand on theirs, or a quiet evening watching their favorite movie. These moments become treasures, etching love into their final chapter. If you're seeing these signs in someone you love, take a deep breath. You're not alone. Countless families have walked this path, and while it's never easy, knowing what to expect brings strength and clarity. Consult doctors to understand their condition, but also prepare emotionally. Discuss their wishes, plan for comfort, and cherish every second you have left. This isn't about fearing the end, it's about embracing the time you have to make them feel valued, loved, and never alone. What moved you most about these signs? How will you use this knowledge to care for someone you love? Share your thoughts below. Your stories inspire us all. Subscribe, hit the bell, and join us for more heartfelt insights to guide you through life's most meaningful moments. Thank you for being here, and let's make every moment count.